Hello, Jordan from Novacards here. Today we're going to be talking about intervals when you read EKGs. This is actually going to be a two-part video because there's quite a lot to cover and I think it's easier just to split it up. In this video we're going to be talking about two specific intervals that are easy to see on the EKG, and that is the QT and the PR interval. You can see both of those on a normal EKG here in this image. The PR interval is the one that's probably the easiest to remember. If a PR interval is prolonged, that is a sign that someone has heart block. If just the PR interval is prolonged and nothing else is wrong with the EKG, that is called first degree heart block, and that is distinct from second and third degree heart blocks, which we'll cover later. QT interval prolongation is a totally different process. QT interval prolongation can happen from a couple of different causes, the most common being medication-induced and genetic. Here's a list of medications that can cause QT interval prolongation. Here are two genetic disorders that can cause QT interval prolongation. We don't have a whole lot of time to get much into the details with these, but you can look them up if you want. If you have a patient with QT interval prolongation and you further prolong it with medications that cause that effect, you can send them into tachyarrhythmias and sudden cardiac death. So this is something to really look out for when you're reading an EKG. Head over to Novacards.ai for study tools for medical students and beyond.